why anyone should know about burns? Is it necessary?
Burns is a very fatal condition and very severely debilitating condition. If it is a large burn, it may be fatal. People may die because of burns.
Burns have any kind of classification or
You have got burned by a flame. आग से जल गया.
Okay.
नहीं तो if you have hot water has fallen on you, hot oil or hot curry, then it is called as scald burn.
What should someone do immediately after burn injury?
What is the first aid? First, whatever is the burn insult, the burn injury should stop. If the burn injury is smaller, you have to keep it either you can open the tap water, you can keep the part on the running tap water.
What are the most common type of burn injury do you see in Diwali?
During the Diwali time, more common burn injuries are with the kids and with the women. Usually household injuries because of the firecrackers and cracker blast injuries. These usually happen in the hand.
And so do all burn scars last forever?
No, not all burn scars. See, superficial burns, which are like first degree and second degree superficial burns, these burns usually heal without scarring.
Okay.
Some take within 2 weeks, some take within 10 days, but they heal without scarring. But the deep burns which are there, they have scars and they last for a longer duration.
Okay.
Namaste. Welcome you all to our new episode of Health Heroes of India. Today we are going to discuss a very important topic called burning injuries and its complications. To learn more about burning injuries, we have invited our guest, Dr. Nitesh Reddy Dharmala. Dr. Nitesh Reddy is a plastic reconstruction surgeon and has an experience of 9 years in this field, and he has treated many patients in his career.
Thank you, sir. Thank you for joining today of our podcast, Health Heroes of India.
Thank you for welcoming me.
And as today the topic of discussion is burn and its complications, we have a lot of questions regarding burn injury. So
Okay.
In few days I have seen a lot of patients regarding burn. That's why we planned this podcast
Okay.
to make the people get awareness about what is burn, why it happened, what is its complication, and why they will get over from this proper injuries.
Okay.
So, as I told you that right now burns patients are more, and we have been coming across a lot of burns patients. So, my first question is that why anyone should know about burns? Is it necessary?
Yes, definitely. It is very, very necessary because burns is very, very common in our country. So, and burns is a preventable condition. If you know about burns, it can be well ahead prevented by taking some measures.
Okay.
So, it is a preventable condition. If you know about it, you can avoid it.
Yes.
So definitely burns should be known by everyone and burns is a very fatal condition and very severely debilitating condition. If someone's sustained burns, it will be very traumatic for them. And if it is a large burn, it may be fatal. People may die because of burns. So definitely people should know regarding the burns.
Okay.
So some basic knowledge, first aid. These are the basic mandatory things that everyone should know.
Yes. Burns have any kind of classification or like grade 1, grade 2 or something like that?
There are multiple classifications regarding the burns. What type of burn is it? Whether you have got burned by a flame, आग से जल गया.
Okay.
नहीं तो if you have hot water has fallen on you, hot oil or hot curry, then it is called as scald burn.
Okay.
If there is any chemical spillage which can lead to a burn. If there is any electric contact with electric wires or electric spark or electric flash. So there are multiple different mode of burn injury. Depending on the mode of burn injury, there are different burns. And nowadays, because of the cosmetic clinics, there can be laser burns if not treated properly.
Okay.
Laser can go very deep and it can cause burns. And there can be some friction burns. These are various other multiple burns type of injuries.
These are type of causes you are talking
Based on
about.
the cause and based on the depth, how deep the wound is. The skin has different layers.
Okay.
So regarding the how much layer, only superficial layer or deep layers are involved. Depending on that, you can classify as broadly superficial and deep burns. Superficial burns usually have good prognosis. They heal better. Deep burns, deep till the deeper tissues are burnt. So it is more fatal.
Okay. Superficial and deep.
Superficial and deep.
Basically, two types of
Two
burns.
types of burns. Yes.
How a normal person, how he recognize that whether it is a superficial or deep?
Basically, in broad terms, for a patient perspective, the patient is having lots of pain. So it is a superficial burn.
Okay, if it's a lot of pain.
Pain.
Okay.
Because only superficial skin is burnt and the nerve endings are exposed, and it will be very, very painful. If it is a deep burn, the underlying deeper tissues are also deeper layers of the skin is also burnt, and if they are burnt, the nerve endings are also burnt. Then it is completely painless. Yes. Regarding a patient, they can know about this.
If its pain is more means that is superficial.
That
or
is
its pain
superficial
is
one.
less means that is
Yes,
deeper.
it is completely deep burn.
Completely. Sir, if basically a burn happen, a patient suffer with burn injury. So what condition? At what condition patient should immediately go for a medical observation or medical treatment?
Any burn which has a large area, or any burns on a specific region, like burns on the face, burns near the eyes, nose or ears, and burns over the genital region,
Okay.
and large area of burns. These burns should be immediately contacted. And any burns of children, very small children and very elderly age group, these people they need a special care for burns. So immediately medical intervention should be sought in them. And any special type of burns like chemical burns, like radiation burns, or any burns because of the electric burns, these burns definitely they should be immediately contacted. They should be immediately seek medical care.
Okay. Just now you two discuss about thermal burn, chemical burn, and I think electrical burn also come as talk as thermal injury.
No, electrical burn is different,
Different.
but it is also dealt by.
So what's the difference between chemical burn and thermal burn? How it differs?
Chemical burn is like, see, chemical burn it may be an acid or it may be an alkali. So both causes different types of burn. What acid does is it will coagulate the skin. So initial superficial layers of it get coagulated. Then this coagulum helps the further acid. It should not go inside. So it will not go inside. This coagulum will stop as a barrier. So it does not cause any deep injury. But in vice versa, alkali does not cause any coagulum. It directly penetrates deeper into the skin.
Okay.
So in a broad perspective, alkali causes more deeper and more damage than the acid.
And that's it.
Yes.
And what about the thermal injury?
Thermal injury is a normal flame burn. Because of heat, the superficial layers of skin are damaged. And the electric burn is completely different. Electric burn is usually very less. And if electric burn it happens, it can cause injury to the skin. It can cause injury to the fat, muscle, bone.
Okay.
Sometimes it can damage, and the bone also can die because of the current, depending on how high voltage current the patient has caught the fire with.
Okay.
So that is it.
So I think first, if I'll grade it in such a manner that first one will be the electrical burn, then chemical burn, then thermal burn.
Thermal burn. And every time that's not the scenario. Every burn, the severity of burn is usually depending on how percentage the burn has happened. The percentage usually we calculate about the surface area of the body. Imagine a patient is there or any person is there, he is 100%. So how much percent of his skin is burnt? That brings the severity of the burn. It may be chemical, it may be electric. Electric 5% burn may be there, but it may be too deep. And thermal burn, if it 10%, okay, it is fine, it can be salvageable. But if it is 50-60%, then it is more severe. So the severity is more based on the percentage of the burn, more than the type of the burn.
Yes. Let's talk about what are the emergency care a person should go for. Tell me what should someone do immediately after burn injury?
Okay. So basic first aid should be done. What is the first aid? First, whatever is the burn insult, the burn injury should stop. If you get burned by a flame, you have to stop the flame. If you are getting burned by a current, you have to stop that. So remove the electric supply should be cut off, or else the flame should be stopped first. And whoever has caught the fire, if no one is there around, they have to drop down, roll, and the fire should be stopped using sand or water, whatever is available nearby. The fire should be stopped. Once the fire is stopped, check whether the patient is conscious or not, and whether the pulse is there or not. And then you can take care of the burn injury. If the burn injury is smaller, you have to keep it, either you can open the tap water, you can keep the part on the running tap water, or if there is a small bucket of water, you can keep the hand or whatever the part is burned in the water. But make sure that if the whole body, a major part of the body, large surface area is burnt, large percentage is burnt, you should not completely go and get immersed. This may cause temperature changes and hypothermia. It will be more problematic.
Oh,
So if it is a smaller burn area, just immediately cool it under the tap water till your pain has come down.
okay.
So there will be pain initially. Till the pain comes down, keep it in a bucket of water or keep it under running tap water. And once the pain is subsided, then immediately you can get a medical.
This is only for small burn injury, small,
burn,
area of your
small
body.
burn. If large area burn is there, you have to cover the wound first. Same, stop the wound, stop the fire, then stop the fire which patient has caught, and then just cover the wound with either a clean cloth or a sterile plastic drape. Plastic drapes, you get the plastic drapes nowadays, so you can cover it with a plastic drape or any dressing or bandage, and you immediately get the medical intervention.
Okay. Sir, here if it is a superficial burn in the body or deep, if it is superficial burn in the body, larger part is involved. At that time, at this condition, what we should do?
At that condition, if the larger part is involved, if a large body part is involved, just you have to cool it down and immediately get a medical intervention immediately. Don't delay. You can just cover the wound and immediately take him to the nearby hospital.
Okay. Though there is no such kind of proper awareness in our society, or maximum people of our society that don't know how to take care of burn injury, they do some mistakes. What are the mistakes you should tell they should not do?
First basic thing is, if you ask to cool the wound, what people do is take ice and put the ice directly over the wounds.
Yes.
What happens is, if someone puts the ice directly on the wound, it will cause more cellular damage. It will cause cold damage.
Okay.
So there is already heat damage to the skin. Now you are giving more cold damage to the skin. Just normal temperature water or normal tap water
Running
will be
water.
fine. Running water. You can just clean the wound or put in some bucket, and just that will be fine. No need to put ice or chilled water on the wounds.
Okay.
Second thing, people apply whatever people say around, or whatever they get. Usually people apply toothpaste, ink, Ratan Jot, whatever they get, just they apply. Some people crush the tablets and put that powder. So don't do all this stuff. Doing this will cause more chances of infection. So basically, skin is a barrier. It protects your body from all the sort of infections.
Yes.
Skin is covering all your body completely. So if any infection is coming, if the skin is lost there, it is more prone to infections. You are directly putting something over it. So that causes more damage. And second thing is, if you cover the wounds completely with some other thing, whatever, toothpaste or ink, so whenever you consult a surgeon or plastic surgeon, there will be a difficulty to assess the type of wound. Usually, how deep it is, how superficial it is, we assess the wound looking on the wound, looking on the color.
Assessment only, just okay.
We'll assess the wound color. There are multiple ways to assess how deep it is or how superficial it is. It will be difficult for us, and there is a more risk of infection. So better not to do all this.
Shall we apply turmeric powder, something like that?
No, nothing. Nothing is required. Just get a medical attention immediately. That would be more better. Turmeric, all this all causes more contamination of the burn wound.
Okay.
Initially, when the burn has happened, the wound is sterile. It is not infected.
Okay.
So you put on whatever you keep on it, it will cause more infection. That would be more problematic than helping the patient.
So suppose a small superficial burn is there. For a small superficial burn, that is also required to visit the doctor.
No, if it is a small superficial burn, less than the size of your palm,
Yes.
then you can
Very
consider it. Then it is not required. If it is a small superficial burn, you can just have a small first aid at your home, and you can apply some topical ointment.
Topical.
Just skin ointment would be
Okay.
enough. Any antibiotic or basic ointment.
Okay.
Then take the wound care, proper wound care you take, that would be fine.
Many times we have seen that after small burn injury, basically blisters form.
Yes.
So people start popping it like with something.
Yeah.
So what's your advice on that?
See, popping, this is also not advisable, because once these blisters have come, people usually pop it with a safety pin or whatever is available, they pop it. The safety pin is not sterile, so it can cause infections. So once you pop it, you're introducing an infection. So
Yes.
you better, if there is blister, that means it is superficial to deep burn. You better get a medical attention immediately, so that there is no sort of infection. Once the dressing was done in a sterile manner, that time we can pop the blisters and we can do the dressing.
Okay.
That would be more advisable. So popping the blisters at the home is you're introducing some infection again
Okay.
on the wound.
Suppose if there is a small blister on your finger or somewhere, if you keep it, you don't do any kind of popping or something. You don't do, but you applied some. As you advise some kind of topical gel or something like that, you have ointment applied, and you don't take any further medical advice, because I'm talking about whether you are staying in a rural area
Okay.
where there is no such kind of doctors available. On
Okay.
that conditions, how a person should take care.
Okay. In that conditions, any rural area, you can just basic primary healthcare or basic first aid, it is available everywhere. So you can go there. It can be just punctured and it can be dressed.
Okay,
that would
doctor
be
will
more.
puncture that.
Doctor will puncture. That is more advisable
Hmm.
because you don't know what you're puncturing it with. A small wound
Yes,
will be
yes.
converted into a bigger
Big.
wound, or it will take more time it to heal.
Yes.
So it is better to get a medical intervention. If the blister is done, just go, one visit would be enough. It would take care. First dressing is done nice, then the patient will heal nicely if it is a small one.
Okay. Sir, what are the signs of a burn infection, and how a person should recognize it early?
So first thing is the wound which should heal in normal span of time. If it is not healing, it is taking a longer duration of healing. So then you should be doubtful that it has got infected. Second thing, there will be fever. If the patient is having any fever, or the wound and surrounding the wound, if it is red and it is more painful, then these are the signs of infection. If there is any discharge from the wound, or if there is any pus pouring out from the wound, these are all signs that the wound has got infected.
Okay.
And this will immediate medical intervention is required even if it is a small wound.
Means if there will be any kind of color changes.
Color changes,
Fever?
if there is any redness, any fever, pus discharge or
Okay.
wound discharge, or it is taking unusual amount of time for
Time.
healing. So
Okay.
these are some signs of infection.
Okay. Thank you, sir. Sir, what I've seen in our India, due to some crackers firing, or like Diwali, due to burn injuries are common. So,
Yes.
what are the most common type of burn injury do you see in Diwali or after Diwali?
During the Diwali time, more common burn injuries are with the kids and with the women. Usually household injuries because of the firecrackers and cracker blast injuries. These usually happen in the hand.
And
So hand injuries. And if it is a smaller cracker, that won't be it'll be more of a burn injury itself. And diyas, one of the most common burn. And because diyas,
Okay.
problem being with the diyas, they are usually kept on the floor.
Mhm.
And our women have saris
Saris.
and dupattas. These will be freely floating in the air. So whenever they catch fire, usually they don't know. By the time the whole body gets fire, they would be knowing that, oh, okay, I got caught fire. It is too late by the time.
Yes.
By the time whatever the damage should have been done, it is already done. So diyas are the most common and most worst burns we have seen with diyas. Usually in the puja rooms also,
Yes.
they will be praying or they'll be doing some prasad or whatever, and they'll get caught fire. This is more common. And recently with newer crackers, newer burn injuries will happen, and cracker blast injuries. People will be shoving some this gunpowder into this cracker materials.
Mhm.
During that, if any burn happens because of the pressure, that will cause blast injury. When there is a blast in the hand, it is not only burn, it is also injury to the hand. All the small bones in the hand get fractured, multiple. The hand gets literally crushed. It will get blast, and it is a very devastating
Yes.
injury. This is usually very common in youth. Once it happens, if it has happened to this right hand, and it is gone, it is very tough to salvage the limb. And even if it is salvaged, we don't know how functional the limb will be again back. So very devastating injuries. This cracker blast injuries, anything blasts in the hand. Once the hand is gone, the person
Yes.
livelihood is gone.
Right.
Yes, that is a problem.
So, sir, when a burn injury patient comes to you or a burn injury happens, is there any critical time that within that type of period, if you treat the burn patient that will be very effectively and get healed
Yes, it is. It is preferably
immediately?
immediately, because first 48 hours of the burn injury is very critical, because prompt treatment in the first 48 hours, it will help the burn wound to stay superficial. There is always superficial burn, deep burn. It is a mixed pattern of burn. Some areas are superficially burned, some areas are deeply burned. There is a in between area which is in between superficial and deep. If you properly treat in time, within 48 hours, if proper IV fluids are given, you prevent the shock, then this burn injury, this burn wound which is there in between, it can turn into superficial.
Okay.
Usually what people do is they delay that. Once this golden period is gone, you come to the hospital, the intermediate zone is also become deep wound.
Okay.
So the amount of deep wound has increased. So
Yes.
if the deep wound has increased, eventually it will take longer duration to heal. So and in the initial 48 hours, the wound is very sterile. It is free of infection. Once you get a medical intervention at that time and the proper dressing is done without infection, you can treat the burn wound for a longer duration.
Yes.
So first 48 hours are very, very critical.
Okay, before 48 hours only you have to consult.
Immediately. The first 24 hours will give fluids, ICU management. This is all very critical.
Sir, in rural areas, typically like hilly areas, so to get such kind of doctor facilities little difficult. Even
Yes.
hospitals are there, but doctors are not there.
Okay.
So in that condition, what's your advice?
In that condition, when if there is a burn, and first thing is cool down the burn wound. Once the cool down the burn wound, clean the burn wound with a clean cloth and cover it with a clean cloth. And you should encourage the patient to take more amount of fluids. And in that fluids in particular, you can take some ORS fluids, or you can take some sugar and salt. If there is no ORS also, take some fluid, say water. You mix some sugar, you mix some salt in that, and ask the patient to consume more of water, because there is more loss of water. Intravascular volume will get reduced in the burns in the first 48 hours. So
Okay.
this is important. At least you take 4 to 5 liters of fluid for a healthy adult. That
Okay.
is minimum. So fluid plays a major role. Still, you can't get any medical attention. We advise the patient to take more of protein diet. So more of eggs. These are more important.
Okay.
So immediately water is the main thing. So we can at least advise the patient to take more of water, hydrate himself, avoid dehydration. That would be the best thing they can do.
Okay, let's talk about some myths right now people are doing, and even the educated patient, those who knows also, they also follow the same sequences.
Yeah.
So I'll ask one by one, and please answer us.
Sure.
Is applying butter or toothpaste on a burn really harmful?
Yes, it is harmful because
Butter
it is
also.
a clean wound. You're introducing some sort of infection. And second thing, the surgeon face a lot of trouble to assess how deep is the wound. And
Okay.
it will be more painful for you. Once eventually you come back, we have to clean the toothpaste again. It will be more friction and you'll be having more pain. So
Yes.
this is all causing more and more trouble to everyone.
Okay.
So it is not advisable.
Patient also, doctor also.
Doctor, both.
Do all burn scars last forever?
No, not all burn scars. See, superficial burns, which are like first degree, second degree superficial burns. These burns usually heal without scarring.
Okay.
Some take within 2 weeks, some take within 10 days, but they heal without scarring. But the deep burns which are there, they have scars and they last for a longer duration.
Okay. Deep burns last for long.
Yes. Deep burns, they heal by secondary intention or they have to be grafted. Once they've grafted or healed by secondary intention, they form usually hypertrophic scar or keloid scars. These scars are very bad and they stay for longer duration.
Is it true that only fire causes serious burns?
No, not at all. There are electric burns, there are chemical burns.
Yes.
There are a lot of burns which are more dangerous.
Hmm.
Again, severity is again depending on the surface area, how much area is got burnt. So electrical burns may be a small area, but they are very fatal and very difficult to treat, and they cause damage to the bone, nerve, muscle, whatever is underlying, whatever the way current passes through it, everything will get burnt.
Can burn injuries always be avoided with fire resistant clothing?
No,
No.
not every time,
Yes.
because
What is
there are
fire
some
injury?
burn injuries. If happened in a closed space, the injury can happen due to inhalation
Inhalation also.
of smoke.
Okay.
Because of the fire, the smoke which has come, it contains carbon monoxide. Once you inhale that, it is more poisonous. It is
Okay.
deadly. So closed space burns is also very, very dangerous.
If you're wearing a fire resistant cloth,
If it is, if the burn injury, insult of the burn, fire is for longer duration, definitely they'll get burnt.
Yeah.
Any material can't stop. And
Okay.
if there is a situation, if anyone is getting burnt in a closed space, immediately they should get out of that room.
yes.
At least they'll not get the carbon monoxide poisoning. There are cases where there is no single burn injury to the whole body and the patient has not survived because of inhaling the fumes.
Okay.
So it is more toxic. It will completely burn the whole trachea and all the respiratory system. It will burn inside. It will get swelled up and the patient can't take breath and they'll die.
Okay.
So it is so fatal.
Do skin color affects how a burn heals or scars?
No, usually there is nothing,
There is nothing
like
like
that.
that. So let's talk about the psychological and emotional aspects.
Yes.
So how do burn injury impacts patients' mental health in a long term?
Yes, it affects very much because burns is a very psychological disorder. Also, problem being it is a very stressful disease.
Yes.
The the trauma which the patient goes through during the burn is one of the most painful conditions anyone can see, and it is very painful for the dressing. If a burn survivor is there, they become so sensitive to pain because of the repeated dressings, repeated pain, and it is very traumatic for them. So most of them will be having anxiety, depression, post-traumatic stress disorder. It will be very tough for them. So involving a psychologist or counselor, psychiatrist into the treatment protocol as a team, so it helps the patient a lot.
Counseling is required.
Yes, definitely it is required. It is very painful condition. So it is very traumatic for
So
them.
you told me it's very deep injury, pain is not there.
So at the time of burn,
It's not there.
because the nerve endings are dead, once that dead skin is removed, eventually it has to be removed, it will get removed, and then the normal granulation tissue will form, and this is all very painful.
Okay.
So only at the time of burn, if there is no pain, that means the skin has been completely burned, and if there is mild pain, only superficial is burned. Once it is gone, again it is hell lot of pain. It is
Oh
very
my God.
painful for the patient. So you can hear the screams outside of the burn ward. It is very scary.
And once a long term means if there is scar is present on the face or something like that, in the case of ladies or gents, that also gives it mental trauma.
Yes,
Like
yes.
every time he sees them,
It is very tough for them socially
Yes.
because they are very bad, one of the very bad looking scars.
Yes.
So it is very tough for them, both mentally and socially. It is very difficult to cope. But if the proper scar care or scar routine is given, we can make it better. We can't completely make it disappear, but we can make it better over time.
In your career, have you made like one patient comes to you, but he's very curious about his body, skin texture, or something like that?
Yes.
In that case, in that patient, how do you manage?
So yes, that is definitely there with young women or young females who are unmarried. They are very particular about how they look, how they look.
Yes.
So it is very troublesome. It is very problematic for them, and for a surgeon also it is very difficult to treat them. So first we'll give them counseling. Counselor plays a very good role in this, psychologist and a counselor, and then we'll give other various modalities of scar revision are there. We can get the scar revisions done. We can get a scar revision surgery. Or we can improve the texture with using PRP. Patient's own blood, we take it and we centrifuge it, and this PRP, platelet rich plasma, is used to infuse into the scars, or we can give some steroid injections.
Okay.
And there are something called as fat grafting. Fat grafting. We take patient's own fat, we process it, and we make either microfat or nanofat, and these can be used to modify the texture of the scars.
Okay.
There are lasers. We can send them for lasers. And there are anyway camouflage makeups are also there. We can try to camouflage or make sure that scar is less visible. If the scars are smaller, we can excise it serially. Slowly,
Okay.
we can multiple stages. We can remove it surgically, or else if it is a bit larger and there is surrounding normal skin, we can use something called as a tissue expansion. We can use
Tissue expansion.
Yes, tissue expansion. If there is a scar here and there is surrounding normal tissue, we increase the size of the normal skin by using silicone balloons.
Okay.
We use silicone balloons, we increase the size of that skin, and the scar tissue is excised, and that excess skin is used to cover this area.
Okay.
So this can be done, but it is a very longer process.
For this, how many times the patient has to come for the surgery? Is a surgery required?
Yes,
for this?
that is tissue expansion is a surgery. In the first stage, we have to insert the balloon or silicone balloon. That is the first stage, and eventually, every weekly twice or weekly once, we inflate saline. We increase the size of the balloon by inserting saline into it. After 6 weeks or 4 weeks, depending on the size of the expander, once the expansion is complete, we'll wait for 4 more weeks, and second stage surgery is done. We remove the expander and we excise the scar and we advance the growth, excess skin which has been produced, that is advanced to close the defect.
Okay. So how many times the patient has to come?
So it is like a multiple visits. So first surgery is done. Every week the patient comes to the doctor. We have to inject saline. There are newer modalities, self-expanding tissue expansion devices are there. If the patient is well educated enough, they can do it on themselves, but it is usually not advisable. They have to visit hospital every week, sometimes twice a week. The tissue expansion is done. This is done on a period of 4 to 5 months, depending on how big the expander is. Then once this is done, and then they have to get eventually another surgery done.
It depends upon the
size. It basically depends on the size. If it is bigger, it will take more time. So usually it is months, period of months. Over a span of months, it will take.
Okay. Maximum in this case, family plays a very important role.
Yes.
What advice do you give to the family members of the patient?
See, family plays a very, very major role in the burns patient because it is more traumatic, painful, and family support is very, very important because nutrition also plays a very major role. The patient can't feed on themselves. It is very tough for them to stay motivated all the time. Some people are very strong and they get motivated all the time, but over a long duration of time, burns is a very challenging thing to go through.
It takes time.
Yes, it takes time. So emotional support, financial support, and nutritional support, everything should be provided by the family. Big support to the burn survivor. If the family is not there, it is very, very tough for them. The supportive family should be there. They should be supporting them in the nutrition. They should be rehabilitation. They have to take multiple follow-ups, multiple surgeries. So this is something very, very important. Yet some people ignore it. But if it is there, it is very easy for the patient. Both emotionally and financially also their support is very, very important.
If it is an adult case, it's okay. If you are coming to a child case, pediatric case, burn injury are also common in pediatric.
Yes,
also.
Very, very common.
Because many times we have seen also, we have come across also. So how do you approach if a child or pediatric patient comes to you? How do you approach? What do you approach?
See, any child burns, the approach is like immediately we'll assess the burn, what is the type of the burn and how deep it is. Once the assessment is done, usually the more common form of burns in child is scald burn. Scald means fall of hot water or hot liquid or hot oil. This usually happens in the household. That's because child over this age group, they'll be roaming around here and there. So they'll be hitting the vessels or utensils, whatever it is there, or any hot tea or hot thing is kept. Usually nowadays this form steam inhalation. People while taking steam inhalation, accidentally they just spill it over their thighs and the groin region, everything get burnt. So these burns, once they come, we assess how much percentage it is there. And children, if it is a small burn, is also major striking feature is their surface area is very less. If small burn for an adult for the same size and child, it is very, very huge burn. So immediately we need to admit them. We need to give proper fluids, and then we'll do a special collagen dressings. We have multiple specialized dressings. Timely usage of these specialized dressings may help in healing. There are some dressings where 1 or 2 dressings, the burn will be completely healed if it is superficial. If it is a deep burn, then it is a challenging thing in patient.
I came across with a child. Actually, his father was doing treadmill. Walk on treadmill, and the child was playing nearby. So after it was hot, actually the treadmill was hot, and while roaming there nearby only, he touched that with his right hand to the treadmill, and immediately it got burned. He came to a plastic surgeon. From there he came to me for making a splint. So on that condition, the parents were very much worried about that because that's a girl's child. Whether it is girls or boys, everyone should worry about condition.
Definitely. Children are so playful, they don't know what is
Yes.
hot, what is cold, they just directly catch it. So that is the problem. And there is this thing called whenever there is cables or any plug adapters or plug points are lying down, children without knowing this, they just keep their hands in them. This causes electric burns.
So
This
in
is
this
very
case, parents should be very careful.
Yes,
because
they
this
should be careful. And even in the kitchen should never be unattended. Always when there is cooking is happening, it should be attended.
yes.
And usually children shouldn't be allowed inside the kitchen.
yes.
So
Yes.
that is main thing. Nowadays it has improved, but previously or in many places there is a single room, that is the kitchen, that is their bedroom, everything is that. So they do floor cooking. Floor cooking is another major problem where you can see lot of scald burns. Child will be playing there, cooking also will be done on the same floor. Accidentally there will spillage, and child would be there in adults' hands. They'll be drinking some tea or hot milk. The accidentally child kicks it and it will fall down.
No.
So these are the more common modes of burns in children. So they
should
should
be
be very,
avoided.
very careful. These all can be prevented by just patient education, just normal basic knowledge. Patient education, if you know this, these all can be prevented.
Yes. Only this is awareness only. If viewers will see these videos only, also this is a kind of awareness only.
Yes.
If they'll see also this one also, they'll feel that okay, what things to be done or what things not to be.
Yes.
Sir, what are the most common household hazards you have seen pediatric ones?
See, most common, first and most thing is kitchen.
Okay.
So what happens when you do something in the kitchen? Usually, if the handle is placed outside, so when someone hits the handle, the
fall down.
container will fall down. This will cause burns. And keeping the tea or cup, any handles in the edge of the tables, the child will try to reach it. Just they'll slip it and it will fall on the face or it will fall on the child.
Okay.
So these things, and any electrical circuits, small chargers, cables, or plug points. Plug points when they are in the reach of the children, when they are in the near the bottom. So this will cause more burns. And as I already said, diyas placing on the ground.
Yes, and few days before also I met one patient. Hair straightener was there, no?
Hair
So
straightener.
his mother
There's this
did and,
cosmetic
yes.
hair straighteners and hair dryers.
Yes.
These are all very hot even once they're switched off.
yes.
And electrical appliances like iron box, these all should be cooled down completely and stored properly, and they should be present in a locked cabinets.
Yes.
Even the chemicals, household floor cleaning agents, chemicals, these can also cause burn.
Yes.
These should be stored separately in a locked cabinets. They shouldn't be left lying down unattended. We don't know what the child will go and what they'll play. So these are all the things which should be taken care of.
Sir, are there any kind of specific long-term precaution or prevention care a child should take care if he or she might suffer with any kind of burn injury?
Yes, definitely. Burn treatment doesn't end once the patient get discharged. So patient has got discharged, the treatment is finished. That is not the way with the burns, because usually we discharge the patient when the burn wounds are completely healed or they are partially healed.
Yes.
The treatment is only 50%. The only 50% of the job is done. Rest of the 50% should be done by the patient, or if it is a children, the parent. So there should be proper post-operative or post-discharge protocol. There should be proper rehab. There should be physiotherapy. There should be scar care. There should be proper pressure garments and silicone gel sheets should be used to avoid further bad scarring of the burn wounds. And there should be proper splintage, proper physiotherapy.
Splinting.
If proper splinting is not done, there will be contractures, formation of contractures across the joints. This is more common in children because children are not aware that they have to do the physiotherapy. Their joints slowly get contracted. If the burn wound, the burn hand, slowly the fingers will get contracted, elbows will get contracted. This is very debilitating for them. They can't hold a pen, they can't drink water by themselves. It is very crippling. So the treatment is not done once you are gone out of the hospital. It is there up to 1 year. You have to follow some strict protocols, strict physiotherapy, strict splintage, strict scar care. This all should be followed for a better and good quality of life later on.
So my one very important question I come across with many patients. Basically, in burn cases, you prescribe silicone gel pad and stockings, body stockings. So, could you tell our viewers why they should wear it and what are the benefits to wear in a particular time period? What are the benefits and why they should
Yes.
wear it?
See, burn scar, when it is formed, there is a duration of scar maturation or scar remodeling.
Mhm.
Once the scar is formed, it will take almost 6 months to 1 year for it to remodel.
Okay.
This is the phase where you can target and you can follow some scar care tips and scar protocols, so that you can make the scar a bit better. You can make the scar a bit good quality scar.
Hmm.
So if you leave the scar like that, once the scar is there, it eventually causes hypertrophic scar. It forms keloids. It causes itching, and it causes very raised, and it doesn't look good. And repeated itching, you scratch it, and there will be trauma. There will be ulceration. This goes on repeating. So if the proper silicone gel sheet is used and proper compression is used, it should be used for at least 1 year. In the first 1 year, you can remodel the scar in a better way. The pressure helps. The compression garment, which gives good amount of pressure, and the silicone gel has some hydrating properties. This causes the better remodeling of the scar,
Okay.
and the scars evolve betterly, and they don't form hypertrophic scar. These things, it should be done for the first 1 year, and it is very, very important. If these are not done, you have to suffer later.
Yes.
So this is very important in the scar treatment.
So, what are the long-term problems a patient may face if it is untreated or poorly treated?
See, if untreated or poorly treated long term, first you will be having problem with the scars. When the burns won't heal on its own, they heal by contraction. Once the contraction happens, if it is across a joint,
Mhm.
slowly the joint gets pulled away,
Contraction.
and the joint will stuck like this. You can't open the joint. This happens across anywhere, in the fingers, elbows, in the neck, or in the groin region, or in the knees, anywhere. So anywhere across the joint, if there is a burn wound, if proper physiotherapy or proper rehab protocol is not followed, proper splintage is not followed, they causes contracture, and it is very crippling. They can't do their own job.
Okay.
So then eventually they have to get, they will be roaming around the plastic surgeons. You have to get this contracture released. And again, after the release, if the proper splintage and rehab is not followed, it will get recontracture again.
Yes.
So this cycle goes on repeating. So proper treatment and physiotherapy protocol, these are very, very important in the burns.
After
And
the surgery, also the treatment done over there.
it is not finished yet.
Yes.
So there is, again, there is a rehabilitation, proper
Rehabilitation process.
rehabilitation and physiotherapy should be followed, so that you prevent the recurrence of the condition,
Yes.
so that it won't come again.
Which joints are mostly affected by joint contracture?
Contractures. More common is finger joints.
Fingers.
So in the fingers, if the burns has happened, a patient usually leave it like that. Eventually the scar will contract, and it will pull the fingers down like this.
Yes.
Or if it is burnt here, they'll pull the fingers back. It is very crippling. And over the wrist joint, or dorsum, or this one, and over the elbows, axilla. Once the axilla is burnt, it gets stuck like this. So then the patient can't, if there is no axilla, you can't do anything with your hand. You can't even eat or drink properly. So, and neck contracture. Neck contracture is very debilitating. It is a very big social issue. Patient even can't look up. Patient can't look into the opposite person's eyes. So the chin is completely fused. Chin is completely attached to the
Yes.
underlying chest wall. So these are some debilitating contractures, and very common in the genital regions.
In that condition, I think after surgery, if they should go for a proper treatment, rehab treatment like splinting and exercise also, then I think that will be
Yes, that can be prevented on the primary stage itself. In the primary stage, when there is a deep burn of the neck, proper neck exercises, proper splintage, and proper regular physiotherapy, they can completely be prevented.
Okay.
If they have occurred, then definitely they should undergo surgery. And again, the same process they have to repeat after the
Yes, after
surgical
surgery.
release. So they have to follow all these things, or else they can't get away with that.
Like a patient came to you with burn injury. Okay. So if it was a deep burn injury nearby joints. So what's your advice that how you will keep prevention care for the joint contracture?
If there is a deep burns on the joint areas, right from the day one we start the splintage. We put the patient's hand in complete extension. If it is an elbow, we'll completely splint it, and we'll immobilize it in that position. And if it is a hand, we put splints over the volar surface. We put it in safe position, so that from the day one we try to prevent the contractures as much as possible we can. And after the splintage has been done, in between, while removing the splintage and all these things, there is a proper physiotherapy to be done. We'll continuously, under the physiotherapy guidance, if the patient follows everything properly, we can prevent contracture to happen. If this all is omitted, if the physiotherapy is not done, if the splintage is not done, and the deep burn is there over the joint aspects, contracture is 100% it is going to become.
Many patient comes to you for the burn injury, after burn injury. So how do you choose that this patient or that patient, that this patient needs immediate surgery? How do you choose? Any kind of criteria?
Yes, there is some criteria. So there are some latest newer techniques called early excision and grafting. Early excision and grafting.
Okay.
Previous protocol used to be there. Immediate surgery is not warranted in the burns. So immediately first we'll do the dressings when the dead skin is removed, and then first stage we'll remove the dead skin after a few weeks, and after a few weeks, once the wound is ready, then we'll put a graft. We'll do skin grafting.
Okay.
Now latest protocol is, if there is limited area of burns, less than 20% around, and you have proper setup, ICU setup, and you have blood availability and everything is there, we'll do immediate early excision within 72 hours. Whatever the burn wound is there, the deeper burn wounds we'll assess, and we'll excise that deeper wound surgically within 3 days. And that wounds are immediately covered with skin grafting. What this does is, same patient, 20%, if she takes 2 to 3 months for the wounds to heal, this early excision and grafting, the patient would be dressing free within 3 weeks.
In 3 weeks?
Within 3 weeks.
And that's
completely.
the benefit.
That's the benefit. That's the advantage. You assess the deeper areas clinically, you excise them surgically, and you'll put a skin graft over it. This has faster healing, faster recovery, reduced hospital costs eventually. So this is the latest.
And what about the scar?
There will be scars. The same, again, pressure garments are there.
After doing the surgery, like you will wait for the burn to heal, or you will graft it. In both the things, scar will be there, or
scar, if the burn wound has healed on its own, the scar is very bad. And if you put a skin graft, the look of it is different. The thigh skin color and the body skin color is different. It will look different, but the quality of scar is very, very good compared to the burn wound which has healed on its own.
Sir, if a patient comes to you with any kind of contracture already developed, so what are the procedures, what are the types of surgery you make for the release of that contracture?
We'll assess the contracture and what area it is, how bad is the contracture, and what is the residual joint mobility, how is it. We'll assess all these things, and if everything are good and the joints are soft and supple, we go ahead with the contracture release. We do a surgery. If there is a finger completely contracted like this, we'll release the finger, we'll release the contracture, we'll make the finger straight, and we'll put a splintage. We'll put some K wires or wires we put, and then we'll put a skin graft. We'll take this skin from the thigh or the groin region, we put it over the released area, and then there'll be again post-op protocol. There will be splintage, regular dressings. This will be there. If it is a contracture neck, we'll put a skin graft. And if there is a major contracture or any major vessels are exposed, then we need to put a flap instead of graft. So
what is graft and what is flap?
Graft is a thin layer, only superficial layer of the skin we take. That is graft. Flap is something which skin, fat, sometimes muscle, we take along with its blood supply. Graft is we take directly and we put somewhere and it gets sticked. But flap is like we have to take it along with its blood supply and put wherever we need. If the blood supply is not there, the flap dies. So it is like that.
In each child case, if child born is there, so contracture already developed and you did some surgeries and the contracture released right now. For lifelong, whether he has to maintain any protocol or he can live freely?
Not lifelong. There is some duration for at least 6 months to 1 year. He has to follow some strict physiotherapy protocols. Once it is done, once the graft on the skin wound is matured completely, then he can leave it later on. But lifelong, it is not required. So there is strict protocol is there. There will be rehab, there will be physiotherapy, and there will be proper splinting. They should be followed strictly for 1 year. Once it is done properly, after that they can be splint free and they can continue their own job.
So let's talk about the medical and surgical part. What you basically do on the surgical or medical treatment for a burn injury patients. Sir, you do skin grafting. So what role does skin grafting plays in a burn injury?
Skin grafting has a very, very major role in burn injury. See, because whatever burns, the deep wounds are there, deep burns or completely full thickness burns, the burn skin is completely dead. The skin will come off, either we remove it surgically or it will come off through the dressings. Once it has come off, the wound is raw. We have to cover it with something. So we take skin from the thighs of the patients, and we take that skin and we just put it on the wound. Once the wound is healthy without any infection, then we put the skin graft and the wounds will heal. This is a very, very important thing. There are some patients who will be not undergoing skin grafting. If they don't undergo skin grafting, it will take a longer, very, very longer duration of time for the scars to heal. And they'll be healing by contractions. The wound will contract eventually, and again there will be crippling contractures because of that. So in that way, skin grafting is a beautiful tool for burn patients. So if skin grafting is not there, it is very, very tough.
Sir, basically, patient when comes to you with a deep burn injury, what are the stages you take? What are the treatment stages you basically follow?
So whenever patient comes, if it is a deep burn, we'll admit them in the ICU. The initial critical phase will be managed in the ICU. We'll be doing regular strict dressings. We'll be giving aggressive fluid management, fluid resuscitation. We'll monitor the patient's urine output. Once the patient is out of the critical period, then we'll assess the burn wounds, how deep they are, how much part is deep, how much part is superficial. Then we'll assess either if the burn wound, deep wound is very less, we'll manage it by regular dressings. And if the burn wound is very big, then some patients require early debridement, early excision. So we'll excise the wound and we'll wait for the wounds to heal. And once the infection settles down, then we'll put another stage, we'll put a skin graft. So, and once the skin grafting is done, they have to follow post-operative splintage and post-operative rehab. Everything is there. So it is a very long stage and multiple surgeries may come. And if it is a very, very large area, so we divide into stages. Initially, if it is the whole body, so initially we'll graft the lower limbs so that patient can start walking. And in second stage, we'll graft the upper limbs. And third stage, we can graft. If it is a small area, we can do it in a single stage.
Okay. So, how do a plastic surgeon manage facial burn and limb burn?
Okay. Managing a facial burn is completely different compared to the limbs. In limbs, our main goal is function, the range of movement. So the thing is, early wounds should heal and there should be no functional deformity. There should be no contractures in the limbs. But in the face, it is not like that. In the face, it is like, it is visible. It is the mode of expression, and you have critical structures in face like nose, eyes, ears, mouth. So these are very critical structures. So for treating a facial burn is completely different treating the limb burns. So facial, these organs should be given utmost importance, and multiple stages of surgeries can be done for this. And immediate intervention should be done for the eyes if the cornea gets exposed or eye burns are there. If on the lids are get burnt. So if there are any contractures, though the facial structures are given more importance first than the limbs. So, and patient mouth, if the patient mouth is not there, he can't eat anything. If the patient's eyes are got burnt, or if the eyelid contractures are there, patient can't see them. If the patient, the cornea gets exposed, if the cornea gets exposed, patient will get blind eventually. So these are given utmost important and utmost priority.
Yes.
And if there are any facial scars, they also can be managed with multiple ways, lasers, fat grafting. There are a lot of ways to manage them. Scar revisions, we can get multiple scar revisions, and early grafting. So face is given more importance and more priority.
Sir, once the scar form, what are the options available for the post-scar burn recovery?
Depends on how big is the scar and where the scar is placed majorly. And if it is usually facial scars, we can do tiny modifications. We can do some Z-plasties. We can do Z-plasty. Z-plasty is like once the scar is there in a single band, we'll make a Z in that, 2 triangles, and just we'll transpose the triangles so that we can just modify the scar a bit. Okay. So it is a surgical procedure, 2 flaps, it is in the shape of a Z. So that's why it is called as a Z-plasty. So we can modify the scars. If it is at small scars, we can excise them serially. Slowly in stages, we can remove bit by bit, and completely we can excise the scar. And we can use lasers, and we can improve the quality and texture of the scar with lasers or by using fat grafting. So these all can be done.
In a facial burn injury, can we match the skin color, skin tone? If you flap or you will put a scar, you put a grafting, skin grafting or flap, can we match?
It is very difficult, but we can match with multiple treatments with
Okay.
lasers, with the help of the lasers or PRPs, and there is microneedling with later a
So
lot
many
of
things.
treatments, fat grafting, microneedling with nano fat grafting. We can do all this stuff, and we can try to match it. It will be not near normal, but we can make it better than the old scar.
Sir, basically, when the patient comes to you, burn injury patient comes to you, some patient you advise them to ICU for ICU. So how do you assess which patient needs ICU, which patients doesn't need ICU? How do you
Okay.
assess?
So again, depends on what is the age of the patient. Extreme of ages are very friable. So like small kids and elderly people,
Hmm.
they are more vulnerable, and they should be definitely admitted to ICU.
Hmm.
And again, in normal young adults, again the percentage of the burns come into play.
Percentage of burn.
The more
Okay.
the percentage, the more severe the burn is, and they'll require ICU stay for a longer duration. And any burns of special kind like chemical burns, burns to the eyes, burns to the face, and burns inhalational injury. Whenever they inhale some smoke or there is burn injury because of inhalation of fire fumes, the airway will get burnt.
Hmm.
These all are patients will require intensive care monitoring and intensive care support. So these are the patients who get priority over the other burns.
Basically, in child burn injury also, depending on the
Percentage,
percentage of burn.
how much percentage is burnt, it depends on that.
Okay.
When you compare with an adult with a child, same percentage is far more severe and far more critical in kids than
Kids.
adults. So because they'll be having a larger surface area of the face compared to the body, the small part of the burn wound is very big for them.
Yes.
So it is very critical in children.
Sir, few personal question. Why do you choose this field? This did specialization on plastic surgery.
See, basically, plastic surgery was very fascinating to me during my surgery residency. We go to all kinds of postings. We do onco surgery, we do plastic surgery, we do neurosurgery, urology. We go to all postings, and the plastic surgery, I found it to be very fascinating. You can drastically transform someone's lives with a single surgery, and the microsurgery was very interesting at the time. Very challenging both at the same point of time. So it was very interesting, and I thought this would be more fascinating for me. So I wanted to pursue more in that. So that's why I took plastic surgery.
What innovation in burn treatment you are more fascinating about?
So there are a lot of latest technology in burns, like tissue expansion, early excision and grafting, and nowadays there is bioengineered skin. The artificial skin is being made from the patient's own cells. We take some part of the patient's skin, they make the artificial skin in the lab with the patient's own cells, and this skin, once it is ready, it can be used for the patient itself.
Okay.
So the number of hospital duration stays will be less, the pain will be less for the patient, and it will be very easy to manage large burns with this.
In India, it's
No, it is still in the research level,
Research.
but once it comes, it is a great advantage. So these are the latest technologies, and AI powered tools are also there.
okay.
AI helps to assess the severity of the burn. By AI based photo models are there. Based on that, you can assess how deep the wound is. AI can basically, you show a burn wound to the AI, they'll explain how much percentage is deep, how much percentage is superficial. So they can assess based on the photography
So
models.
this is the future.
Yes, future
Till
in
yet,
burns.
it's not available. This facility is not
Just
available.
it is evolving.
Yes. If you were to give any kind of advice to all our viewers, those who are watching these videos, what would be the piece of advice you want to give?
Simple thing: prevention is better than cure. When you know about something, you can prevent it. So patient awareness is very important. Society awareness is very important. So you should be aware what all are the common causes of burn, what to do when there is a burn injury, whom to contact when you
Yes.
have a burn. So this is a major issue where you don't know whom to contact. So nowadays plastic surgeon is easily available in the cities, at least. You can get to the plastic surgeon. So immediate timely intervention is very important. By mistake, if you had got a burn, so whom to consult and what to get done. So immediate timely intervention, proper fluid management, you can make the areas more superficial, and you can can treat it properly. There are a lot of specialized dressings nowadays. Proper, timely, exact dressing which can be done, which can salvage the burn wound very nicely. Proper, timely surgeries. So patient should know where to go, how to prevent it. If by mistake it has happened, what to do, what are all the treatments available. So this is the thing which can be prevented. If it happens, you should know what to do. So it is very, very important for them. And
Mainly
basic
awareness.
first aid.
Yes.
Awareness is very, very
Awareness is
important.
very
for
important,
this.
and first aid also.
First aid, and it is very traumatic for the child if it happens. So some basic small steps and proper care in the child can usually prevent. Usually don't keep child in a lap and drinking tea. This is most common
Yes.
method. Mothers or any grandparents keep the child in their lap and start drinking tea, or any hot foods they consume. By accidental spillage, immediately the
Yes.
child gets burned. This all can be preventable. If you know, you can prevent it. If you don't know, so it will be happening again and again.
One is preventive care. One is if it happened, then what is the
Timely
things-
intervention.
Yes.
So where you have to go, whom to consult, what should be done. So this is all very basic
Very
education everyone should know, so that you can reduce the morbidity of the burn, you can reduce the patient's pain, you can reduce the number of hospital stays, you can reduce the financial burden on the patients. All this.
Thank you, sir. Today we have learned so many things, and I think viewers, so those who are watching this video, particularly, they'll come to know a great idea about what's the burn and what is its complication, and what are the first aid things basically they have to
Basic
do.
first aid.
So thank you, sir. Thank you
Thank
for
you.
joining
Thank you
us
so
today.
much. Thank you so much for inviting me. It is an honor meeting you.